the study. We have a diagnostic protocol of children with autism spectrum disorder who do not have other potential comorbid causes. And my favorite story is Thomas. And Thomas was a normally developing child, and at 18 months was in a terrible automobile accident. And they didn't think he would live. Jack Walker did not think that he was going to live. And he lived. And it was a long recovery. And as he recovered, he went through every kind of psychiatric condition there was. And the first time I saw him, he was 2.5. He wouldn't wear shoes, walked on his toes, didn't talk. And the week before I started seeing him, some of you know me, have seen some of these pictures because I've known him for a long time. He came in my playroom and he started writing words on the marker board. Wasn't talking. And his mother said he started doing that a week ago. And he was just spelling words that he'd seen. And he eventually starts to talk. He's rather hyperactive. He has all of these atypical behaviors. This boy is now in 3rd grade at Rowland Hall. He is multiple grades advanced in reading and math. He's still a different kid, but he has friends and he plays. But when I saw him at 2.5, if anybody had seen him at 2.5, they would have said, this child has severe autism and he's probably going to be terribly impaired throughout his life. This is why you never know. And that's the problem with this diagnostic criteria, is it's a very small group of 300 or 400 children who can study for whom the diagnostic criteria is created. This is for every condition. And Thomas is pretty interesting. And I've watched him evolve and kind of evolve out of his traumatic-based autism, but he was as autistic as they were. When he was in kindergarten, he could read at a 3rd or 4th grade level, and the kindergarten teacher would, when a guest came to the classroom, this is in Rowland Hall, when the guest came to the classroom, would have him get up and read to show how advanced the kids was. And I would see him every other week. We would meet, and he had all these interesting interests, and we would talk, and he got interested in space, and he would lecture me about planets when he was 6. And she asked him to read, and he looked at her, and he responded, "You know I can't read." And she was just dumbfounded. "What do you mean you can't read? Of course you can read. Get up and read, Fred." And she started pushing him, and then he had a meltdown, which was happening to him. And when he came to see me with his mother, and the 2 of them were sitting there because I involved her, he said, "It's not good to be different." This was the first thing out of his mouth. So it had occurred to him that being different was not a good thing. In either direction of the scale. It's not good to be behind in reading, but it's not good to be ahead in reading. You don't want to be that zebra with that red spot on your flank. You want to be in the middle of the pack. I'm not reading, nobody else reads, I'm not doing it. It's very interesting to watch him think through, and because he really wasn't autistic. He met the diagnostic criteria, but he really wasn't autistic. So as his brain matured and he recovered, I was able to watch him kind of think through and explain to me a lot of these things that the kids with autism struggle with, including, hey, it's not good to be different. And then we made a list of differences that are good to have and differences that are not good to have. But he was a reluctant participant. He just didn't want to be a whole lot different. Anyway. Okay.
He's like good now.
He's better than good now. Yeah, because he's in 3rd grade. He's doing 7th grade math. And he reads Harry Potter books and has discussions with me about them.
You know, I'm really glad the way you frame this conversation, because my firstborn, she didn't speak until she was 7, and she got diagnosed with autism. But when she entered the school system at 5, they gave her an IQ test, and they told me she was intellectually challenged. Nothing, I couldn't expect anything. And immediately she was at the top of her class. I put her in dual immersion, Spanish, and everybody was just like, how could you do this? And she's at the top. I mean,
and does she have autism?
Yes.
And so it's very uncommon at 7, if you're not speaking at all, to speak, unless there are certain prerequisites in your behavior and history, right? But it again speaks to why there needs to be a partnership between the professional, and I tell parents, you find one professional that you believe in, that you never questions, even if you disagree with them. You kind of figure out what they're saying, and then don't listen to anybody else. Because everybody's got an opinion, right? And the school personnel mean well. They're trying to help you accept that your child is impaired, but I think that's the wrong goal. It's not. My job is to give you information and guidance and advice, and it's your job to say, no matter what you tell me, I'm never going to lose hope that my child could be something. What's wrong with that? What's wrong with having that hope until the kid is 10 or 12, or until it's pretty clear that the child isn't going to be able to function? Why? It's like the spoon. Why do I have to take it away from you now? Why should I dash your hopes now? Well, how does that help you?
Or I kind of think almost it goes back to developmentally, even the ability to test. I mean, if she
That's
has
a whole
so
other
much
story.
anxiety, so
Yeah, that's a whole other story.
not really.
This population of kids are very difficult to test, and even when you test them, you kind of get what they feel like giving. The little boy I had in the office the other day, this is an interesting boy. He has autism, but he's very different developmentally, and he's very easy, very compliant, very directed, but he's clearly out in the ozone somewhere. But I got him to do puzzles. He's 4.5 at an age-appropriate level. It took a little bit of work getting him to focus, which is why I think maybe a little bit of stimulant might really help him. But to get him to be there, but then when I could get him to be there, he'd say, "Oh, bird," and because he has language, he uses 2 and 3 word sentences, and he put the bird together. But then he was off somewhere else, and I had to bring him back again. And I got him to do expressive vocabulary, looking at pictures and just tell me what the pictures were. And I got him almost to a 4-year level, and then he lost interest. And I couldn't get him to test do anything else. And his mother was terribly we spent 2 hours together hanging out, and his mother was terribly distressed. And I've evaluated 10,000 kids. They're not all autistic. I see brain injuries. But whatever I get, because the test scores are not the goal. The goal is to interact with the kid and gather as much data as I can with whatever's reasonable. And so she was terribly distressed. You weren't able to test him, but you got so much more out of him than anybody else did. Yeah, sure, because I was willing to spend 2 hours to get 2 things done. Whereas most of the schools will say, "Hey, I tried. I'm not getting it done. He can't do it." And I said, "I got enough. And we'll meet next week and we'll talk about it." Between myself and my wife, we have 5, and I can appreciate the angst that one experiences when someone tells you your kid is not going to live independently and not going to function and not going to, and you almost have to be a little like Aaron Brockovich, you almost have to be a little like, well, screw you, here's what I'm going to do. Yeah. But to do that, you have to have a professional who stands behind you, whether that professional is an educator or a speech pathologist or a social worker. I don't care about the letters after their name. They just have to have an appreciation of what they're dealing with and an empathy to understand what you're doing. Okay, I'm late for supper. I don't know if my ramblings made sense. When I go to talks, if I leave with 2 or 3 ideas that I can think about, or 2 or 3 things I could do differently, my goal is to try and shape your mindset, not to give you Sam's 7-step method, or tell you how to change the diagnosis, or I'm not as concerned about those kinds of things. If you are, and I work with you, then we address them. But in this kind of a talk, I just want to impact your mindset. I do think if you follow children's conditions, say ADHD or depression or learning disabilities, autism is the runt of the litter. Autism has been laid into the ballpark in terms of interest. It's been considered a lower incidence condition because it's been defined so extremely. When I first trained, you had to be intellectually handicapped to get that diagnosis, right? And as we've softened the diagnostic criteria, and as I told you before, I'm not saying 1 out of 10 kids has autism, but certainly 1 out of 10 kids has social pragmatic problems. It's pretty clear to some extent that impedes them. Does it impede them enough to get a label or to get a special program? I'm not worrying about that at the moment. So I think you're going to see with autism what we've seen with learning disabilities and ADHD. Now you're going to start seeing more transition programs and more research on what happens to these people when they transition. And we'll use that data in a resilience fashion to then work backwards and say, here's a group, here's 3 out of the group who are doing really well. How'd they do that? Oh, look, they were mainstream. Okay, so if your kid can be mainstream, they do. How else did they do? Oh, look, they had a best friend. Oh, look, whatever helped you guys, I'm gonna try and manualize that for the group that follows. So I think it's gonna get better, maybe not fast enough for some of your kids, but I think over time it's gonna get better. Who has a birthday in April? You get one of these because you need help with the social stuff. Who has a birthday in May? Send it back there. There's somebody right behind you. I hope you're not, now I'm not going to ask you to show me your ID. I'm just going to trust that you. Thank you all. And Jennifer, thank you for everything
Thank
you do.
you.